one speaker to present his presentation, and we'll have a 10-minute Q&A session, and at the end, we will have a conclusion from our faculty advisor. Next slide, please. Yes, before we dive into today's session, let me introduce to you the Society of Clinical Research and Medical Professionals, or SCRMP. Based in Telangana, India, SCRMP is a registered society dedicated to advancing clinical research and supporting clinical professionals. Our mission is to foster innovation, education, collaboration, and clinical research, ensuring that medical professionals have the knowledge and tools to enhance patient care. Through various workshops, seminars, and initiatives, we strive to contribute to global health and the life science industry. Now it's my honor to introduce our distinguished guest speaker for today's session, Dr. Saddam Abdelazim. Dr. Saddam Abdelazim is a renowned nutritionist and clinical research specialist, currently serving as the Director of Nutrition Clinic at Magaga Central Hospital. With over 15 years of experience in healthcare, he specializes in comprehensive nutritional care over patients with chronic conditions including diabetes, hypertension, cardiovascular diseases, and kidney disorders. His expertise encompasses clinical nutrition, pharmacological science, and research methodologies, positioning him as a pioneer as the head of general coordinator of the clinical research department at the Directorate of Health Affairs in MENA. Dr. Abdelazim leads innovative research in areas such as COVID-19, genomics, and dietary supplements. His recent focus involves developing nutrition formulations with dipeptides to alleviate chemotherapy and radiation side effects in cancer patients, a project currently in advanced stage in the Dubai Harvard Foundation for Medical Research. Dr. Abdelazim is also an active faculty advisory board member in MENA Hospital, bridging the gap between academic research and clinical patients. He is a clinical researcher certified trainer at the Ministry of Health and Population in Egypt, educating healthcare professionals on best research practices. His contributions on the field have earned him recognition, including being a finalist for a research fellowship at the Dubai Harvard Foundation for Medical Research and an invited speaker at the RAFA Conferences of Nutrition 2024. Holding multiple diplomas, including in nutrition, in healthcare, and genome science, Dr. Abdelazim combines his robust educational background with hands-on experience, driving his passion to enhance patient clinical outcomes through evidence-based nutrition interventions. His commitment to advancing healthcare is reflected in the experience works in clinical nutrition, personalized nutrition planning, and research-driven healthcare solutions. It's a pleasure to have him in today's session. At this point, I would like to extend a warm welcome to Dr. Ghayur Khan and would like to give the floor to him to have his speech.
Hi everyone, good afternoon. I'm audible?
Yes,
Hello.
sir.
Yes, hi. Thank you so much, Madina. And hi everyone, I am Gayur Khan. I am the board member of Society of Clinical Research and Medical Professionals. And I would like to thanks for conducting such a wonderful conference and such a wonderful webinar. I would like to thanks Afghanistan chapter. I would like to thanks all the advisor. I would like to thanks SCRMP members and obviously the keynote person, Dr. Saddam Hussain sir, Dr. Nazifa, Dr. Rabia, Amir Kabir sir. Hello.
Yes, sir. We have your voice.
Yes, guys. So, what is the main purpose for this webinar is to educate you, to give you the insightful knowledge what is happening around the globe, because sir is from Egypt. He has lot of experience, he has lot of clinical and clinical side knowledge. He is giving your what is happening in around the globe. So this webinar is very important, whether you are from Afghanistan, whether you are from India or any part of the country, doesn't matter. In the healthcare community we all are in the same platform. I believe that, and I want this the type of session is very important in our community to educate each other, to enhance the community, to enhance the pharmaceutical, to enhance the global research, to enhance the healthcare community. So everyone is putting their efforts, and I have a small request from everyone. Whatever knowledge you will gain today's session, you have to implement that knowledge in real life. So that is important. And I'm again thankful to everyone who joined this session. And I would like thanks to speaker sir and everyone who joined this session from Afghanistan, India, and other part of the country. Thank you so much again.
Meals to maintain stable energy levels and prevent overeating. Low glycemic index foods to reduce glucose fluctuations and cravings. Category number 2, medication that slow our metabolism. These medications reduce basal metabolic rate by inhibiting thyroid function or mitochondrial affecting activity, leading to decreased energy expenditure. Examples of this category: beta blockers like metoprolol and propranolol, which reduce BMR basal metabolic rate by 10%. Mood stabilizers, lithium, and thyroid medications, metimazole. So our nutritional strategy will depend on thermogenic foods like green tea to enhance metabolic rate. Also, resistance training to maintain our muscle mass and metabolic efficiency, and adequate iodine and selenium intake in our diet to support the thyroid function. Category number 3, medications that cause fluid retention, edema. This category cause sodium and water retention, leading to unintentional weight gain due to fluid accumulation rather than fat gain. Examples of this category: calcium channel amlodipine, corticosteroids like prednisone, non-steroidal anti-inflammatories, especially ibuprofen, but naproxen is the less one of this category. And we can use naproxen safely and combine the oral contraceptives due to estrogen part in this group. So our nutritional strategy: lower sodium intake to prevent excessive fluid retention, and increase potassium-rich foods like bananas and avocados to make electrolyte balance, and stay hydrated to support kidney function and fluid balance. Other category: medication that promote fat storage. These medications will increase fat accumulation by induction of insulin resistance and altering lipid metabolism, shifting energy storage towards fat deposition. Examples of this category: antipsychotic like clozapine, corticosteroids also, progestin-based contraceptive like medroxyprogesterone acetate, and insulin, which increase fat storage in type 2 diabetes mellitus, which increase the waist circumferences. So our nutritional strategy: reduce refined carbohydrates and add simple sugars to control insulin secretion, and we will depend on healthy fats, which is mono unsaturated fatty acids and polyunsaturated fatty acids, and decrease the saturated fatty acid less than 6%. The last category, which is the miscellaneous by other mechanisms, which cause weight gain through indirect pathways. Induction of fatigue, reducing physical activity levels. Also, disrupting gut microbiota, leading to metabolic changes. Examples of this category: antihistamines like cephalosporin, and it is an exceptional antihistamine which stimulates appetite via H2 receptor antagonism and serotonin modulation. So we can use this drug for underweight patients but require dietary and pharmacological precautions. Opioids, morphine and codeine, which reduce our physical activity, and proton pump inhibitors like omeprazole, which alter the gut microbiota. So our nutritional strategies in this category: probiotics and fiber-rich foods to restore